When I was drive outside the plantation or the development, I would pick up people who were walking alongside the road and give them a lift to wherever they were going, back to the house or to work site. And I invariably asked them where they got their health care, and they invariably said, "I don't get any." That to me was unbelievable. Well, we had two problems. We had the problem of those who had no access to health care, and we had the problem of those who lived on the island who had no easy way to deliver it. So I brought those two problems together, and I made a solution out of it, which we call the Volunteers in Medicine Clinic. And now I'm told now that every person that lives in our town has access to health care, and we are the only town in the nation that can declare that. And based on two mottos, the Golden Rule and the Second Commandment, it was a very simple but powerful conclusion that we came to, and that was, we do not want to perceive them as patients, diseases, or illnesses. We want to perceive them as friends and neighbors who don't feel well and are coming over to us for help.
We have people, all kinds of people young, old, every nationality, and some that are very, very ill, some that are just in for a checkup or come into the dentist.
And we do need this. You'll be surprised how many people just sick and don't have the money, and they don't go because they don't have the money.
If the clinic wasn't here, honestly, I don't know what I'd do.
Volunteers in Medicine accepts no fees. We're open to donations, but patients are not required to pay for their treatment.
41 million without health insurance that are medically underserved, and they're scattered through every state, every city, every town, and every village in the United States.
Yes, there is a need for a clinic like this in this community, and it should be in every community.
Sometimes people just need somebody to talk to and be supportive.
We're not rushed to see patients. We don't have to see a patient every 12 minutes in order to make the budget. If we have to take 20, 30, 40 minutes time, that's okay. It's quite all right.
Because there are people out there that just can't afford the medical bills.
I just can't see every community not having a center like this. This is, it's a blessing.
As the saying goes, you have to give something back sometime.
I think that any community that takes this on is taking on something that will give them greater personal satisfaction if you're working with it, and certainly benefit to the community, way beyond whatever you may measure or survey or anything else.
And the beauty of this is that when you bring those two elements together, you create something wonderful, beautiful and wonderful out of it. And to be a part of it is one of the most exciting things that one could ever experience in their lives.
Loves it. Don't you, honey?
Those people who entered medicine because it was a calling rather than a job or profession are the ones that I think have the most satisfaction and probably fit in the best here.
I feel like in this life that you can't just be a taker, you have to give.
I don't think I ever spent two minutes worrying about whether or not this clinic was going to occur. What we're going to do is to take these plans. When I realized the magnitude of the need and the depth of it, I couldn't do otherwise. And having done otherwise, having done it, having been involved in it and created it, it's not fun. It's something deeper and more enriching than that. It's joy at its deepest level. May we have eyes to see those who have been rendered invisible and excluded. Open arms and hearts to reach out and include them. Healing hands to touch their lives with love. And and in the process, heal ourselves.
Hi, I'm Oscar Goodman, the happiest mayor in the universe, and I'm even going to be happier at the end of this day. What you're gathered for as a result of the hard work of Florence Jameson and her husband Gard is so very, very important to our community to assure that each and every person who lives in this great city is able to get the kind of medical treatment that he or she or their children or their family deserves. And as a result of your efforts, of your financial contribution, of your commitment to this concept, we'll make sure that everybody is going to be able to benefit, whether they have insurance or not, because that's what a great city is all about.
I'm honored to be able to say a few words in support of the wonderful effort known as Volunteers in Medicine. Why do we need such an effort? All you have to do is look at Nevada's statistics. We're at the top in the nation of children without health insurance. We rank first in children not receiving immunization. We rank first in the number of children not receiving preventative medical or dental appointments. Our rates with our working adults is not much better. Why do we need this? It's simple. How do you work a full day? How do children learn in school when they're suffering from an earache, when they're suffering from a sprained ankle and can't afford health care? We need this program for our citizens, for our economy, for our neighbors, for our friends. Whatever you can do to get involved, whether it's volunteering your time, whether you're in the medical field, the legal field, or want to just file paperwork, we need you all, because working together, we can make this an even greater community.
Well, you know, Volunteers in Medicine is just an unbelievable project. There's so many people in our community that are in need of medical services and simply don't have insurance, and many of them aren't eligible for the kind of government assistance that gives them the care they need. Government and the private sector can only do so much. This is such a fantastic program where people from a nonprofit perspective are stepping up to the plate and volunteering their expertise and their time and their services on an ongoing basis. I would encourage everybody to get involved in this and to support it in every way you possibly can. These great medical personnel need the help of all of us who are fortunate enough to have good medical care, to help our fellow citizens to acquire at least something along those lines. Please get involved if you possibly can with this wonderful project.
Hi there, I'm Wayne Newton and I live in Las Vegas. I have lived here for more years than any of us want to talk about. I love this community. It has meant so much to my family and myself. It has enriched my life, and I'm sure most of yours. However, what is disturbing to me are all those less fortunate who have no health insurance and do not qualify for Medicaid. There are almost 350,000 people in this community who are confronted with this tragedy. These are the ones who, if you will, fall through the cracks. They have no access to health care until now. Fortunately, there's a group who wish to fill this void. They are known as the Volunteers in Medicine of Southern Nevada. Now, land has been promised on which to build a clinic with architects and attorneys donating their talents, times, and skills. It will be manned completely by volunteer physicians and nurses who will be providing free medical services. This is their mission, and I applaud their desire and passion. I support this program, and I thank you for your support.